Okay?
Don't move your head. Don't move your head. Don't answer with your head. Just say yes or no. All right?
Okay. All right, we're going to get started. I'm going to give you a little numbing medicine first.
Yeah. Thank you.
All right. Well, you know, there's not much I can do with a pressure like that. Yeah, I'll just wait. No worries. 8 cc's injected of local. And we're all doing an L2-3, 3-4, 4-5, 5-1. All right, for those of you watching, we are going to be doing a Deuk laser disc repair. Lay still. Our patient has a little bit of claustrophobia. Oh, that's a nice picture at 5-1. Nice job. We may be a little bit off on orbit, but your WAG is nice. All right, I'll get started at 5-1 then. Are you guys ready for me? All right, let me know how we're doing on the blood pressure. Are you uncomfortable? Shot? All right. He's okay, good. That's good. So we start by placing needles to access the spine, right where the problem area is. I wonder if I can go a little lower. Where you start is important, shot. And of course the trajectory itself is important. I'm going to try to give a little bit of numbing medicine to give him some more relief because it can be uncomfortable. We call this a spinal needle because it's designed to go to the spine. Shot? How's he doing? Shot? Huh? Squirmy? Shot? I'm not happy with that foramen. I think you're off. Shot? Keep playing with it till you get happy. Shot? Huh? Shot? Yeah, I think that's worse. Go the other way. Give me a shot. That may be better. It's really hard to tell because his facets are so arthritic. And we've already established that his facets are a cause of his pain as well. Shot? All right, AP. The facet joint is what's that big black lump, blackish gray lump right in front of the needle. For those of you wondering, what is a facet joint? All right, so it could be a little bit more lateral. Yeah, there's a giant laminectomy defect. This patient has had surgery before. They've had a laminectomy. Let's go back to the lateral view. So I need to be a little bit more lateral. He can move a little bit, you know, from my standpoint, as long as we get his blood pressure under better control. Huh? No problem, no problem. What's the issue, Shot? Oh. Shot? That's pretty good. Shot? 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 That's a little better. His facet joints are so big that we're literally having to go really wide to get around them. And that's totally abnormal, but is he awake? Shot? We're making good progress. How much improvement can you get with the blood pressure? Shot? All right, let's get an AP. We're getting caught up on the, believe it or not, what's called the S1 superior facet. And I don't mean believe it or not, but yes, we're getting caught up on the bone that covers the entrance to the spine. Yeah, because he's got so much arthritis over there. Let's keep going. Now the laminectomy defect you can see in the middle of the spine. It's that whitish, looks like a ghost going up about 1, 2, 3, 4 levels. We had another name for it earlier this week. But, all right. Yeah, I'm just bouncing against the bone. So I have to go even more lateral. Shot? 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 Man, that is tight. This is probably, on a scale of 1 to 10, this is a 10 out of 10 from my standpoint. I know from an anesthesia standpoint, Dr. Berndes was complaining about it being a challenging anesthesia case as well. All right, let's see what we got. We got a good trajectory and we're really close. If I could just, maybe a millimeter is all I need. Shot? It looks like we're almost there, right? We're still getting caught up on that S1 facet. That L5-S1 facet joint on my side is really enlarged. Shot? And it's making it really difficult, shot, to get there. Shot? I'm gonna have to. Last time I got lucky, I got in. Looks like we're kind of there, huh? What's he saying? AP? The 5-1 is the hardest disc to get to in everybody, and especially if their spine is collapsed. Snoring blissfully. Well, wait. Yeah. I think we're close. Give me a lateral. So again, you can see the bone spurs sticking out just by the needle there. All that is abnormal. The next disc has a huge bone spur too, but not quite as bad as this one. I think we're close enough, Luis. What do you think? Maybe we're not inside the disc, but we're close enough that I think we can get it later with the dilator. What do you think? Oh yeah, there. Ah, I just did it. Shot? Uh-huh. Yeah, it's being forced. Just like it was last time. Remember last time? Shot? Is he awake enough to be reliable, AP? So we've got a deflection of the needle, and it's either a good deflection or a bad deflection. We don't know yet. We need to look at the AP. Yeah, it's actually not terrible. I'm going to leave it. I'm happy with that. It was the same thing we did last time, and when we did his left side. How are we doing on blood pressure? Let's get some local. No, I'm sorry. Num num. shot. Is that it there? All right, so I'm just giving some medicine into the muscle to make it more comfortable for him. He's snoozing away. You know, he's not an easy patient because of his airway is easily obstructed. You got to get 4-5 lined up. And let's get that tube out of the way, Luis. It's just, I need to see all the detail I can see. So let's see what you got there, Jordan. Wow, I thought we saw it better earlier. The trajectory's not bad, but shot. That's pretty good. I just can't see the pedicle as well, but I think we're okay. Yeah, shot. I think that's it. What's the issue, guys? Shot. How are you guys doing up there? Yeah, this is a painful disc, that's for sure. But we're in. Shot, that's the good news. Huh? We're going to need a light? Yeah, well, let's see what we got. Shot? Yeah, okay, there it is. So we're really hitting the back of L5 at the top. Let's get an AP. At least we're in the safe zone, which is where I would expect us to be. That's good. It's perfect. Lateral. So at this point, I've positioned my L5-S1 needle as best I could. Again, he's got massive growth of bone spurs around his facet joints. The joints are really enlarged, like you see in arthritis. And it's at L5-S1, that's the best I can do, but I'm not really inside the disc. I'm just outside the back of the disc. Whereas L4-5, I'm sitting just outside the back of the disc as well. And I'd like to get my needle to go a little more north. And I could be right inside that disc. Shot? I think he's tightening up a little bit, and that's fine, because we're in a really good position there. We're just not going to get a good discogram. And we did the discogram last time, and it was very positive at all 4 levels. He was 10 out of 10 for back pain at L2, 3, 3, 4, 4, 5. There we go. Got it. So he loosened up a little bit, and we're in. We're in like Chet. See that? We got it. Next one. I'm going to try to do 3 discs with this one incision. Let's see if we can do that. And doctor, you're still working on blood pressure. I'm sorry? Hey, you're the expert. I just want the blood pressure down. I'm easy. I tell you what I want, but you figure out how to do it. Is he doing all right? Lay still. Shot. So we're just about finished with three discs. Shot. Are you awake?
Yes, he is.
Or where are you having pain? I can feel the herniation here.
Where's the pain?
I think it's his back. Yep. This is that other painful disc. Yeah, we're in. See how easy 3, 4, 4, 5 were relative to 5, 1? All right, now we're going to have to put our last one. You're doing great. I already numbed the area up here. So I'm going to go ahead and place the L2-3 needle. Shot. I can feel the facet. Shot. Okay. The surgery you're watching is endoscopic spine surgery. It's called the Deuk laser disc repair. It's been peer reviewed and published. Everything is FDA approved. Don't move. You're fine. Again, with this patient, because we don't want to make him too sleepy, otherwise he'll stop breathing. What we're trying to do is keep him light enough that he's comfortable. Let me give him a little more numbing medicine. That might help out a little bit. This is not. Why, do you want epi in it? Yeah. The skin had epi, but that was a while ago. No, it's not. All right. This is just lidocaine marcaine without epi. Shot. It's too low. But look how big that facet is. Shot. Shot. Yeah, he doesn't like that. That's the facet joint. He's fine. Shot. You're doing great. We're almost done. Shot. This is the last one. Shot. Shot. Do we have AP? Do we have the X-Burl? It's going to be for the other side. No, it's okay. All right, we've got all 4 needles almost in place. We have one more going in right now. And honestly, we don't need to do the discogram, doctor, because we did it 2 days ago. They're all positive. So all we're here to really do is treat a stenosis and debride the annular tear, remove the herniations here. What? Can you do any better? And the only reason I'm saying that, he does have pain where we did the surgery last time. There's going to be some hematoma in the muscle. That's always due to blood pressure. So if we can keep it low, then we don't get that hematoma. We don't get the muscle pain. All right, we're ready to get started. Do you think I can get started? Yeah, I want to do dye. Yeah. So again, we're not looking to record the discogram this time. I just want to get some dye in so I can see the, I got it. I can see the herniation. Yeah. Shot. Oh, that's 5-1. Huh. Actually, we are kind of in the disc. That's pretty cool. Just in the beginning of the disc. Shot. Good. That's good. Guide wire. Shot. Yeah, he's still having pain from these levels as well. Yeah, we're done with the discogram. So he responded at each level to the discogram. Shot. Yeah. Yeah, so I don't need to record his numbers. I already know that these discs are painful. And you can see they're even painful on this side. So even though we fixed the other side because he has bilateral, this side's painful too. We'll fix that. Shot. Shot. Okay, so we're going to start with L3-4, the L3-4 disc. We're going through the foramen. And I'm going to push this dilator right through the tear, the painful tear. Shot. This is where the herniation is that's hitting his nerve that goes down his leg. So my job is to get rid of that herniation, to unpinch the nerve. And he had his left side done already, and he was very happy with the results with the leg. Shot. He does have some facet pain, and we're going to do a little shot on that and give him some relief. Very common for people to have both disc problems and facet pain. And doctor, I'm fine with the level, the depth. If you want to lighten him up, you can, if you feel that's safer. Again, I don't, as long as he's going to be fine, I'm fine. Shot. I'm
Doc,
actually, yes.
Got a question from YouTube.
Yes.
From Tom. Is
Uh-huh.
the
Hi,
patient
Tom.
awake?
Patient is asleep, but it's kind of like you being asleep and something is picking your foot, like a little needle poking you on the toe. So you kind of like sleepy, but not completely asleep. So is the patient under general anesthesia? No. We don't want them under general anesthesia. We decided not to put them under general anesthesia. Generally, we need to know as we're doing the procedure if I'm too close to a nerve root, and the patient will say, I have leg pain. So we keep the patient awake to do that, and that's why they're awake. With the cervical case, the one we do on the neck, we don't need the patient awake. We put him to sleep. Blue towel. Thank you. All right. So he's kind of sleeping right now, but he's not under general anesthesia. He's still responsive. So if we hit anything that's too painful, he's going to respond.
Lights off, please. Thank you.
All right, so we're inside the L3-4 disc. Remember, we fixed the other side 2 days ago. So it's kind of cool being able to go into a disc again. Look at the herniation right there. So if somebody has a herniation on both sides at one disc, you got to go to both sides to fix it. Especially if they have like nerve problems on both sides. If a patient has herniated disc but only one side, one nerve is affected, like say the left or right, then we only need to go to that side. But this patient had weakness in both legs, so we had to do both sides. You okay? Huh? I'm sorry? All right. Well, you guys are lighting him up, right?
Yeah.
Yeah.
You can use the light. You want to turn on that light? Where's that light? Top. No, number 2. For them. Yes. Thank you. Thank you, Rita.
You want me to stop?
Yep.
Huh?
Yes. Scope off, please. Thank you.
Do we need to move the fluoro out? Get the bed.
Get the bed, please. Get the bed, please. Thank you. Thank you.
Get the gurney. Yeah, we're gonna have to abort the surgery, guys.
Keep going, Vanessa. Keep going, moving all of that.
Fluoro out.
Yeah.